First question, what is Artemis?
It's a web-based system that's designed to take the math out of medicine. It's a system that's designed to standardize processes. It's a system that's designed to reduce errors, to eliminate errors whenever possible, to improve communication, to help teamwork. What we need to do is to be able to think about the patient and the critical decisions. And right now, the logistics, the details of doing things have become so complex that what happens is people spend their mental energies and their time and the resources trying to figure out how to do things that could be standardized. So Artemis is an attempt to standardize processes in acute care to free physicians to think about the needs of their patients.
Who uses Artemis?
Well, Artemis is used by physicians, nurses, paramedics, EMS, respiratory therapists, pharmacists.
What departments in a hospital use Artemis?
Artemis can be used with virtually every department. It now has adults, pediatrics, neonatal. It has acute drugs, but it also has prescriptions with a real emphasis on pediatric requirements. So it could be used in an urgent care setting. It could be used in an office. It can be used in the ER, the ICU, writing discharge instructions on the floor. And so we see this as a universal approach to medication safety and medication administration.
Can Artemis be used by EMS?
So we do have a system for pre-hospital. And the basic system has been around a long time. In North Carolina, for instance, by law, they call in, quote, the Broslow tape color just to give a heads up of the hospital. So this is part of a basic communication between somebody in the field who's picking up a sick or injured child and the ER where they're taking the patient to.
Do you have mobile apps?
Yes. Everybody wants to have apps. Our apps are designed for a number of reasons. One is because we're a standardized content, we want people to have content no matter how they need to access it. Our core system has been a web-based system. This is what we started with. We have it in almost 200 hospitals. Our apps, and they're called SafeDose, have the same content. They have a different design because Artemis is a comprehensive system. It has flow charts and burn treatment and certain aspects of clinical content that are best represented on a large screen. But the content itself, the medication content, can be represented on a small screen, and that's what we do with the apps. So it works on an iPhone or an Android, and it works even better on an iPad. And these are very inexpensive. The SafeDose app, for instance, is free, so you can't get much more inexpensive than that. We have a SafeDose Pro that has our barcoding feature in it and the ability to log in more detail, and importantly, the ability to document when things happened off your mobile and then to email that or print it so that you have a log, even as an individual provider, a nurse, an EMS physician, of what your thinking was and what you gave and when you did it. And you can always use that later to document in a paper system or an enterprise system.
What are the main uses of Artemis?
The main use of Artemis is to help simplify, standardize, and safeguard acute medication administration, looking at the whole process. Selecting the vial, selecting the concentration, doing the conversion to mils, knowing the dilution for that indication and the side effects. So that's on the administrative part. We kind of look at Artemis like bookends. Like there's two bookends part of Artemis. One is the output of the order, and that's on the medication administration. This helps the pharmacist and the nurse, could be the anesthesiologist that's mixing their own medicine, or the paramedic, or the transport nurse. This is on the medication side. On the other side is the clinical support, and this is a whole other part of Artemis. This has to do with putting medication, putting fluids in context. The context is I'm treating a septic shock, I'm treating a PALS algorithm, I'm treating a burn. And so there's clinical support information related to every process. So a physician, for instance, that's ordering a medicine that they're familiar with, they can just click on it on CPOE if they have it, and that does it. But say it's a medicine that they haven't given a lot, and they're not sure what the dose is, or what is the dose for this indication, or what are the side effects when you give it this way. How do I write a prescription, not for amoxicillin, what I do every day, but Flagyl for a 7-month-old with an anaerobic infection? Our system allows you in a couple seconds to have access to very granular, exact information. So how we see docs using it is just like they might use a shortcut at home. It's minimized on their computer. They're working in CPOE. Gee, they have a question. They really don't have the knowledge base. They don't really want to look it up. They click. Artemis comes up. They put the medicine, the indication, and the weight. It tells them exactly the process and the dose. So we see Artemis kind of coming up and down on your screen. The other thing is, once people become familiar with the content in Artemis as a large screen application, they're going to find more and more value on the safe dose and the small screen because they'll be oriented. They'll know where these bits of information fit in.
Physicians have references and dosing guides. Why is Artemis better than using a book?
Well, I guess the best analogy is you're flying a 747. And so you're up at 35,000 feet and you get an alert that says that the hydraulics went out. So do you want a book and open the chapter on hydraulics? How about if it's electronic? Here's a link and then you get the chapter on hydraulics. Do you want to start getting oriented what the categories are, reading the paragraphs, or do you just want to say, this is what the problem is, this is what I want to do? What's different about Artemis is we are not a book. We are not an electronic book. We are a clinical access information, and we take information from huge sources, have put it in a database so we can look at what you're doing and give you exactly what you need for that particular problem. So that's what's different.
Does Artemis need to integrate with my EMR?
That's kind of a loaded question in a way, because the implication of that question is I don't want to use it if it doesn't integrate. The irony is, the advantage of Artemis is it doesn't have to integrate. If you have to do something in real time with just a couple seconds, the last thing you want is to try to enter the patient's data, their name, their birthday, when you need to do something in a few seconds. So Artemis works much like a shortcut on your computer at home. You click it and it comes up. You can treat the patient, no matter what the problem acutely, with Artemis. The point is that Artemis is designed to treat a patient. It's not designed for inventory, it's not designed for charging, it's designed to make sure that that patient with an acute problem, whether they're a child or an adult, has the adequate, correct treatment in real time. So the idea is that no matter how the drug is ordered, whether it's a verbal order, whether it's through CPOE, whether it's a written order, Artemis can tell you how to give that medicine, how to fill that order correctly, time after time, with no math, no memorization, no going into your pocket to look at a reference or pulling up your electronic references or books. It's all contained within Artemis, and it all works within real time.
Can I use the Artemis Log feature to get information into my EMR?
Well, anything that's done on Artemis, you can log, and you can record, and you can document. Artemis right now is a standalone system, so how do you get information out of your log? Well, you can print it, you can email it, or you can save it as a PDF. For instance, when we do cardiac arrest, right now, what are people doing? They're writing on paper towels. They're not recording anything in real time except scribbling on a piece of paper, and we don't know if it's accurate. Doing an algorithm like an ACLS algorithm or a PALS algorithm in Artemis allows you to follow the algorithm, have a standard process for administration, and then document what you did. And so this is all available in real time. When you're done the code and the patient is stable, you can always type in the patient's name, scan in or type in the account number, print it off. You can edit it if you need to, and you could use that then to put the information within your existing systems, or of course you could scan it and send it right in as a PDF.
With Webbased Artemis, what do I do if I don't have internet or the internet fails?
Well, Artemis is web-based, and the reason is because of the huge amount of content and our need to have peer-reviewed updates. We want Artemis to be updatable in real time. So that's clearly an advantage of cloud-based approach, and I think a lot of people have realized that. Obviously, the downside is, how about if my internet is down? Well, fortunately, that doesn't happen a lot these days, and you can kind of plan for it. In Artemis, we have possibilities as backup. One is some of the very basic information, like the dose in milligrams, the mils, can be printed. So some hospitals have made books of this information, or just print out the individual sheet to put on the chart just in case they need backup. The safe dose, although it doesn't have all the flow charts as Artemis, has the basic standard medication administration information. Of course, that's an app, so you don't need internet at all. The third way is PC downloadable, and we have this as a backup system. It has all the basic information. The advantage is, of course, it doesn't need internet. The only disadvantage is from time to time it needs to be updated, whereby the web-based system is updatable in real time.
After the purchasing decision, how long does it take to roll out Artemis? What's the fastest you've done it before?
Yeah, it's interesting. I go back to our Apple analogy, saying that we wanted to be able to work out of the box. We've actually had experience with 3 hospitals recently. One was a North Carolina hospital that we were able to show them Artemis for the first time on a Friday morning. And I went up to their ICU and used their existing system. It was McKesson. Their barcode scanners just went to our site, and it worked right out of the box. And actually, by Sunday morning, they had in-service their nurses in the ER and the ICU. So they were actually able to use Artemis within a couple days. We actually had a hospital in New Jersey that got the demonstration to a cross-discipline group, pharmacists, even the CEO, nursing, physicians, and some medical students and residents on a Friday morning. And within 24 hours, they had actually treated an adult patient in their ER using the barcode scanning application based on their present existing software. So that was 24 hours it was up and functioning.
How do you train people on Artemis?
We tried to, first of all, going back again to the Apple analogy, we tried to make something that is very intuitive. And we have found that people within a minute or two understand how it works. It's really kind of, it's touchscreen or just select, and there's not a lot of data entry. So as a system, a lot of the features are just intuitive. What we did was making sure that people understand the depth of the system and some of the really unique applications. We decided to keep that electronic, our education, so it's an e-learning system. And so we have a web-based system that it familiarizes you with a lot of the features of Artemis, and we have a certain amount of testing that we do, not to see whether you're smart or whether you're educated or whether you're well prepared, but whether you're familiar. It's almost like a scavenger hunt. So what we do is we show you the features, we have videos that show this and also text. Then we give you some questions that force you to navigate it, and then when you're done, you have a good familiarity with it. And this is all done online.
Is Artemis customizable?
Is Artemis customizable? It is customizable. There are many medicines. They come in many concentrations. JACO wants standard concentrations. They don't want them fixed casually, but with a standard process. So what we've done with Artemis is, one is we can have customization on the regional level. For instance, we work with a large group of hospitals that have a commonality in what they carry. So when Artemis is put in those hospitals, each hospital sees their version for that hospital group. But in addition, the things that are changeable on an everyday basis, for instance, maybe there are 4 concentrations of a drug, but maybe you only carry 2. Well, in Artemis, as an administrator, you can go in and just click the minus, and those 2 are off your system. In other words, people will see your version within your own hospital. So what you're doing is you're customizing yourself for your staff. Now, if it turns out that you made a customization, say a drug that was available in a certain concentration, and then suddenly it's not available, you can go back through Artemis and just reset it to match the concentrations that you do have.